The first thing that you're supposed to do is expose the injured area so as to examine how big the wound is and which type of wound you're dealing with. Then you tell the casualty to apply pressure so as to control the bleeding itself. Then you need to get your equipment, the ones that you're going to use to control the bleeding itself, of which you're going to use a dressing so as to control the bleeding. And every time that you are dealing with a casualty, you need to be talking to them and finding out how they are feeling. Then after that, you need to cover the wound. And whenever you are covering the wound, try as much as possible not to tie the wound very tightly, because sometimes it might lead to impairing of blood supply. Then we usually advise to tie the knot directly on top of the wound, because it usually helps in applying pressure to the wound itself. Then if you need to transport the casualty, you'll have to tie a sling. Sling basically is one of the things that we use in order to immobilize the limb itself. Tell the casualty to support the injured arm. Then after that, you apply the bandage. And the type of sling that we are tying right now is usually referred to as elevation sling. Its main aim is just to give support and also to regulate the flow of blood to that area so that in order to control it. Then after that, it's usually advisable that you ensure that the casualty gets to hospital for proper medical checkup and also assessing of the wound itself. Also confirm with the casualty if the bandage is too tight. Then after that, you just inquire with the casualty which hospital they are supposed to be taken.
If you find a casualty who's lying on the ground and you're not sure what is wrong with them, you need to start from the beginning again. You check for any danger towards the casualty, even passing traffic. If it's on the road, moving vehicles, traffic could be a danger to the casualty. Even bystanders could be a danger to the casualty. Then you check for response. Ask the casualty a question. Give the casualty a command, then you tap the shoulders gently. If the casualty does not respond, we say that they are unresponsive or unconscious. So you open the airway using the head tilt and chin lift and check for breathing for 10 seconds. You determine that breathing is present, you check for pulse. Using the neck pulse or the carotid pulse, you check for 10 seconds also to determine that pulse is present and is okay. Once you determine all that, you do a quick frisk of the casualty. Or we'd like to call it a head-to-toe examination. Just to ensure that there is nothing that could have caused or to try and determine what could have caused these casualties, unresponsive or unconscious state. You check the hands one by one, check the shoulders to determine whether the casualty has any broken bones, check the chest, just check the whole abdomen, try and feel the back, the whole spine, as you keep checking your hands for any bleeding, any signs of bleeding. Check the pelvis, listen to the pelvis, open any tight belts, then you check the pockets, or loosen the belt, then you check each leg by itself, or then you loosen any shoelaces, tight shoelaces. Then you check the other leg for any bleeding, casual, or any fractures. Once you determine that there are no other injuries, you start placing the casualty in the recovery position. Take the closest hand to you and place it in a right angle. Then you take the other hand and place it against the cheek. Then you bend the outer knee, the knee farthest away from you. Then you slowly turn the casualty towards you, making sure that the head is okay. Keep the head tilted also. And you monitor vital signs, check for breathing again, and check for circulation. So that is known as the recovery position. You're supposed to monitor vital signs at least every 10 minutes. So if you determine the casualty stays like this until help arrives, or until he stops breathing. That is why we monitor vital signs. So if the casualty stops breathing, you turn them back to the position that they were in, lying on their back, and start CPR. Once you assess that the casualty is unresponsive, you open the airway using the head tilt and chin lift maneuver and check for breathing. Check for breathing for 10 seconds. Once you determine that there is no breathing, you go direct to the chest and start giving chest compressions. You give 30 chest compressions. After the 30 chest compressions, you get your mouth guard and give 2 mouth-to-mouth ventilations. Make sure that they are full ventilations, that the chest rises. Then you continue with your 30 chest compressions. You do this for around 2 minutes. That is around 4 or 5 cycles. And then you go call for help if help hasn't arrived. So you give 30 chest compressions and 2 mouth-to-mouth ventilations, or you can call them rescue breaths. Make sure that you seal the nose as you give the mouth-to-mouth ventilation so that air does not escape through the nose. And the chest compressions, you give them at a rate of 100 chest compressions per minute to try and replicate the work of the heart.
So whenever you're dealing with choking, the first thing that you're supposed to do is when you approach a casualty, first of all, you will see the signs from a distance that the casualty maybe was eating something, then all of a sudden the behavior starts to change. So as a first aider, when you approach, the first thing that you also need to do is ask the casualty whether they are choking, then ask if they need your help. So the first thing also you need to do is encourage the person to cough, because choking can either be a partial or complete obstruction. Then ask the casualty how they're feeling. If it's not yet out, you will go to step number 2, where you give up to 5 back blows. Sometimes the obstruction might come out, but after the 5th back blow and still the obstruction is still in, you will administer abdominal thrust. Up to 5 abdominal thrust. The first one, second one, third, and the obstruction maybe might come out. Then after that, sit the casualty down, reassure the casualty, and you can also give water after the obstruction has already come out. You can give water. Then there are several people that you are not supposed to administer abdominal thrust to them. Then these 3 types of people are who? One is expectant, the other casualty is someone who is obese, and an infant. Those are the 3 types of people you cannot be able to administer the abdominal thrust. While you're dealing with an infant, the first thing that you'll have to do is turn the infant facing down. Then after that, you give up to 5 back blows. Then turn to the side and see if the obstruction is out. If it is somewhere near where you can remove it, you can slightly scoop it out. But if it is not possible for them, we'll administer chest thrust. So we administer up to 5 chest thrust. You'll continue alternating back blows and chest thrust if the obstruction does not come out. The first thing you need to do is stop the casualty from running, because by running, it's one of the major aims of fanning the fire. So it means that the fire will continue burning. Then you will wrap the casualty so as to kill off the oxygen, because it's one of the components that must be there in order for fire to occur. So you need to kill off at least one of the components for the fire, which is the easiest is oxygen. After wrapping the casualty, you'll drop them to the ground, then try them to roll so as to also try put off the fire that is inside the blanket. Then after that, you will monitor the burns, the extent of the burns, the damage, the degree. Then you need to get help after dealing with the casualty.